Hi, my name is Dr. Gasemi, and I'm going to be talking to you about hip problem. So whoever is joining us right now that has hip problems, I hope that this is going to be beneficial for you. Every week, I come in with different body parts, and my whole goal on Wellness Wednesdays is to help you have a little bit knowledge about how to take care of yourself at home, what are the things you can do, and if you need us, you can always go to BAX-U.com, schedule a telemedicine. I'll be happy to take care of you. So let's talk about hip pain. So one of the things that I wanted to share with you is a lot of people think that the pain that they're feeling on the side of the leg is hip pain. I want you to know that last week we talked about sciatica, or in one of our previous episodes, so look it up on our website. But sacroiliac problem, or the sacrum, the two dimples in your back, those are SI joints, and they can cause symptoms that feels like a hip pain. So today, you're going to understand what exactly is a hip pain, where is it, how is it affected, what are the types, and what are the symptoms of hip pain. So if that is the case, you see those? That's not a hip pain. So let's see what a hip pain is. Hip itself is if you take your hand and put it right on your side. So some of the ladies, it would be the saddles, the side saddles. For men, it would be almost the seam of your pants, or where your pockets are, where you put your thumbs in. Okay, so hip pain is actually a ball and socket joint right here. It's the only ball and socket joint in the body. It's the largest one. The second one is the shoulder joint, that allows the body to have a fluid movement, and it's cushioned by a little cartilage structure over here. This area we call them acetabulum, and this is so your leg bone comes straight up and it tilts just like here, and it settles comfortably in almost a crescent shape, a little bit more than a crescent, so it can move in different directions of forward, backward, twisting forward, twisting backward, up and down. So this is the hip joint motion, all right? Now, there are different types of problems that occur as a result of hip problems, such as arthritis. Typically leads to inflammation. It's a gradual pain that progressively gets worse. Then you might have hip fractures, mostly seen in either high repetitive injuries, so especially runners, or in elderly, as the bones start becoming more osteoporotic. Right? The first sign of it is osteopenia. Take an x-ray, you'll see it if it's there. The second one is tendonitis. So this ball and socket is connected and strapped into place so it doesn't come out or dislocated by structures. The endings of a muscle turns into a white tissue that attaches to the bone, and they're typically responsible of moving the joint into gross ranges of motion. Then tendonitis is usually caused by repetitive motion because the muscle is being contracted so much that at the origin or the insertion of the soft tissue bone structure, it pulls, and that constant pulling creates a little shredding or micro tears, and that's called tendonitis. Soft tissue sprain strains is either due to repetitive activities, but also I want you to pay attention to this because we're going to talk about labral tear. Is when if you've ever been in a car accident, as soon as you see a dangerous environment and you're ready to guard or brace for impact, the first thing that you do is you press your right foot on the brake really hard, and you just slam that hard. Upon the impact, your right leg is stretched out, your left leg is in a 90-degree angle, and that causes a sudden shift. That sudden shift is something that causes labral tear. Labrum is actually a structure that is typically on top of the acetabular joint, and it connects it's an additional connection for the ball and socket joint of the hip joint. Repetitive twisting motion can cause labral tear, whereas arthritis, also known as caused degeneration, is more of a repetitive non-twisting motion, more like a weight-bearing type of motion. There's another condition called avascular necrosis. A means not, vascular means blood supply. Necrosis means the dying of the tissue. So when there is a reduced blood flow to the hip bone itself, it will cause the tissue to die, usually caused by repetitive stress injuries, fractures. Also, if you're taking prednisone for a prolonged period of time, they will cause your bones to be brittle, and the first sign usually occurs in the hip. And the reason it happens in the hip is because it's the most weight-bearing joint. Okay, so find an alternative to find the underlying cause of the problem that's to have prednisone and try to reduce that or change it with some alternative methods. It's very important for me to share with you that arthritis is two types. You have the inflammatory rheumatoid arthritis, which is a lower percentage compared to the majority. Over 90% of arthritis are degenerative, also known as wear and tear. That means there's not a systemic issue, it's actually a musculoskeletal issue and an alignment issue, okay, which is much easier prevented. Now, if you have issues with your hip that you need to urgently contact your physician, is if your hip pain came up all of a sudden, out of nowhere, if you had a fall or an injury that triggered your hip pain, so an x-ray is essential. If your joint looks deformed or it's bleeding, so you see like a little necrosis or little black and blue underneath your skin. If you hear a sudden popping nose followed by immobility or you can't move, that's another factor. Intense, severe pain, usually occurring with night sweats. It's a major indicator you have to contact your physician on an immediate basis. If you can't put weight on your hip, like you can't walk, it's not even possible to move, you want to contact your physician. And if you can't move your leg or your hip, so something has either caused it to fracture, dislocate, or it's interrupting its normal movement. And we need to identify where is that underlying cause coming. So if you don't have those if you do have those problems, contact your doctor. You can also try over-the-counter medications, non-steroidal anti-inflammatories. It may require hips replacement. Typically, redness, swelling, warmth around the joint are indications that you definitely want to contact your medical doctor. And here's the medical approach. Then you have a non-medical approach, which is more of a conservative approach, more of an organic approach or natural approach. So those are when you don't have an acute pain and you've been screened at the no contraindication to any kind of treatment or exercises, then this is your option. Exercises. So what kind of exercises do you do? We'll discuss that later on. There's a concept called PRICE. That means protect the area, rest your area, ice it, compress it, and elevate it. These 5 acronyms of PRICE are extremely important in treatment of musculoskeletal injuries. Physical therapy, physical rehab, chiropractic alignment, acupuncture for pain management, and also low back exercises, stretching, resistive training also can reduce pain and improve mobility. In every physician's approach, our goal is to reduce your pain. Once we reduce your pain, then we have to try ways to prevent the damage from reoccurring. And that's where we play a role as natural practitioners. So let's talk about underlying causes. There are some factors that are compensatory. Your hip point pain is really as a result of problems occurring somewhere else. With the change in our working structures, working from home, or if you have an ergonomic area that's not working for you and it's kind of aggravating you, you'll notice that your body starts shifting. So checking your posture is extremely important, or a posture of a loved one that is complaining of a hip problem. Very important to prevent a huge array of symptoms that could occur and that could cause a problem, such as hip problems. So let me tell you a little bit about the kinematic chain. What you're seeing over here on this side is called the kinematic chain. Kino means and kinematic chain means that every single structure is connected to the other like a chain reaction. So if you're having problems with your head, so how many of you are on your phone with your head down? How many of you tend to lean to one side when you're driving? How many of you have a pattern of standing on one leg more likely than the other. These are your body patterns. And if these patterns continuously go on, they retrain your body to be in that position, causing abnormal stresses to the bones, tendons, ligaments, and bursas, other soft tissue structures around your skeletal system. Typically, when one area gets affected, it will take an impact on the segments above and below. So if you are suffering from hip pain, groin pain, buttocks pain, or pain radiating to the front of your leg, I want you to really pay attention to the position of your patella, your kneecaps, how you position your feet, the arches of your feet. Also take a look to see how you sit when you're working. What is your sitting position? Those things are the factors that can cause and affect a lot of problems in your body, which are easily preventable. So when we look at you, when you come into the clinic, what do we look at when we're evaluating you? We evaluate you under 3 planes of your body. We look at you from front, we look at you from side, and we compare right to left, front to back, and look at the movement in these 3 planes of movement, right? So we're looking for scoliosis or problems, structural problems. We're looking to see if there's any hip issues. And then hip issues fall into 3 major components. Is it an iliopsoas problem, which starts from the lower back, attaches to the hip, typically caused by a lot of sitting? Is it a TFL problem, which is tensor fasciae lata? It's the tendon, it's a little muscle that's on the side of your hip, and the tendon is the longest one that goes from the side of your hip crease, like around here, goes all the way and attaches to the side of your knee. Or is it the SI problem, which is the sacroiliac, right? So we want to know what is the position integrity of your lower back, pelvis, sacrum, and your hip and your knee. What are these structures? How are they working? Why are they causing a problem? Are there any other clues somewhere else that we need to pay attention to find the underlying cause of your hip problem? Those are the things you also need to pay attention to. So what are the signs of a hidden problem creeping up before you wake up with pain? Frequent falls, twisting your ankle on frequent basis, if you feel a little clumsy, if you have pain on one side of your body predominantly, if you have foot pain, you have back pain, if your pain keeps switching, those are the factors you really need to pay attention and come in to get checked. So what if it is identified as a hip problem? Where is the pain? Typically, hip occurs around the groin area and inside of your hip joint and on your thigh, outside of your hip joint and buttocks. It rarely goes to your lower back. If it goes above the 2 dimples in your back, you already have either a sacroiliac problem, more of a sacrum, L5, S1 area, or if it goes above your 2 dimples in your back, you're looking at the lumbar issue. So those are very important that you pay attention to. So anterior, where you see this little green area, ladies, if you sit and you cross your legs and you have hip problem, you know you're causing a twisting in your pelvis. So if that's how your pelvis is sitting, it's shifting. And that puts more pressure on one side versus the other. Does that make sense? Gentlemen who are wearing your wallet in the back pocket, don't be surprised if you get a lot of buttocks pain and a lot of side pain. Or when you sit, if you're sitting and you have pain right in the bony part of your buttocks, and you could just put your hand under your seat right now and feel that bone under your buttocks, that is called your ischium, which is right down here. That's the pink area. Typically creates a bursitis, and bursitis is repetitive tear or wear and tear on that area. Bursas are like a little egg yolk. So they are there to cushion between the muscles. And when they're compressed for too long, repeatedly, they create the inflammation. And that's easily treatable. So easy, it's ridiculous. Why be in pain when you don't have to? So a couple of areas you do also want to check is we want to make sure it's not a hernia that's radiating as a hip pain. Diffuse pain, not like a specific pattern. If it's a specific pattern, we're really looking at more of a nerve pinch from your lower back. But if it's more of a diffuse pain that is somewhere around there, you're really looking at either iliopsoas problem, a bursa, a tendon issue, more of a hip issue rather than a nerve pinch or a disc issue. So one of the things that I want you to pay attention to when you're exercising or when you're doing physical therapy movement or just physical movement, your body is balanced by having these planes, the sagittal plane, the coronal plane, the transverse plane. That's the plane that if we divide the body from the belly button into upper and lower. If we draw a line from the side of your shoulder and just slide something in between the front and the back, and if we draw a straight line from your crown of your head, your nose, chin, down through your chest, straight down in between your legs. These are different planes that allows the body to move in the three-dimensional planes. So you move in flexion, extension, lateral bending, rotation, and even a combination of those. These are planes of skeletal planes, right? But there's also something called the muscular system or the soft tissue. So if you combine the hard tissue and the soft tissue, these two are constantly in a beautiful symphony working with gravity. And how the body works, it also works with the fascias supporting the muscles. So it's one structure. And that way, what you want to do is you want to make sure the exercises you do always have a balance in movement. And you could look by, if you're doing upper body movements, make sure that your extensors are balanced with your core. So upper back, front, lower. So if you look at this image, right in the superficial plane, when you're exercising, make sure you're working on your flexors. These are the ones that bring you down, okay? If you're working on your extensors, which is your back muscles, those are the muscles that pull you back. So if you are sitting or standing or tend to be a sloucher, you know you're overworking the front of your body and underworking your back, which is not stabilizing you. It's very typical of people who sit. People who sit tend to weaken their posterior muscle groups. So their extensors get shut down, they're too weak to balance the front, and the gravity is constantly pulling you in different directions. Hence, you get that crooked body, right? So, speaking of sitting, tell me, which one of those do you find yourself when you're involved with your work and you've totally lost track of time or even forgot to eat? I'll let you simmer on that for a little bit, right? Okay. When you sit in the slouch position, your pelvis and your buttocks move forward. So your pelvis goes into posterior motion. The ball and socket position is changed. Your thoracic spine goes into forward position because your head tries to balance itself with its hip. So the toll is taken on the spine and on the muscle supporting structures in the pelvis area. So now look at let's take a little dive into the consequences, right? This muscle is called iliopsoas. It starts up there and goes down here and connects with your ilius. This is psoas major. They combine together and they attach to your hip. And they're responsible for lifting your leg up, right? These are the tendon structures that we talked about. These are the ligaments. Sorry, these are the ligaments. This is the tendon we talked about. This is your bursa, and that's a little gelatinous structure right in the middle that reduces friction between the muscles, so you do not get muscle damage. And these white little things are all ligaments that connect the pelvis together, so you're stabilizing one position. Any changes in the integrity of the alignment with the hip, like this plus sign between the spine and the pelvis, is going to affect the balance of the muscles. And on an x-ray, we always look at the tip of the hip compared to here, the integrity of the ball and socket position. Are they shifted? What is the integrity of the joint? Is it too far away? Is it too compressed? So those are the things that we look for. We look for these two that looks like a little Batman eyes, like here. These two little masks, we look at the integrity of that. Women who have given birth to heavy babies tend to have this area very much shifted. So don't be surprised if you get foot problems, ankle problems, or knee, or even a SI problem like sciatica. What do you do? So now that I gave you all the gruesome parts of the hip problem and all the factors that you really want to look into, is look at screen a posture. So the best way to check a person's posture and alignment is, you see that circle over here up there? That's your earlobe. That earlobe should be aligned with the middle of your shoulder. That line goes through a straight line, aligns with the hip, side of your knee, and the outside bony part of your ankle. This is what we call plumb line. Plumb line is basically a structure that allows the best body position with respect to gravity, with the minimal amount of pressure on your discs, joints, and also the least overloading on the muscles. When the head is forward, especially we see that in our teenagers or people who are on the computer or text or on social media a lot, the head moves forward, the body balances itself by pushing up. Then weak, and once they're weak, they lose the integrity of the pelvis, rotates forward, leading to the hyperextension of your knees and array of problems. So you either have forward head carriage, you either have a flat back, hyperlordosis. So position of your head, your upper body compared to your lower body, if not addressed, will cause adult onset scoliosis, meaning that you were not born with it, it just happened because of functional changes in your body. Okay. I don't mean to sound boring, but I really want you to take a look at yourself in the mirror, that you have to go to a doctor's office. Just by looking at yourself, evaluate yourself. If you have a friend or if you have a personal trainer you work with, have them spot check you, have them look at your posture, all right? Or if you have any questions, schedule a telemedicine appointment. I could do that for you on the computer screen. So, speaking of checking your posture, one of the things you really want to pay attention to is your ergonomics. Your ergonomics at home, which we have a webinar on this specifically on our website. If you're interested, it's only 30 minutes, but I really dive into set workstation. So if you from with your laptop from the bed to the kitchen counter to the dining table to the sofa and floor, and you keep moving around, settle down, find the spot. That should be your spot, okay? If you have a sit-stand desk, make sure that you stand during the day and you sit in the afternoon. Alternate. The reason being is when you stand for a long period of time has caused restless leg syndrome. For females, it has caused an early fibroid issues and genitourinary problems. It will cause low back problems. So please alternate to reduce the load on the muscles. Make sure that, again, your posture is your thighs, make a 90-degree angle. The distance between your screen is should arm's length away. I don't know if you can see this over here. Yeah, very good. Wow, that looks really scary. But instead of having it straight, I want you to lift up so that way the tip of your fingers are right alongside the crown of your head. That's where your computer screen should be. All right. This, a lot of ergonomists might have a little challenge with this statement because that's what they were taught. It's wrong. What you want to do is you want to keep your head up. The reason being, we want to keep the integrity of the curve in the neck. You lose the curve in the neck, you've started a whole series of headache, neck pain, arthritis, loss of balance, visual disturbances, repetitive allergies, stuffy nose. It's just a whole series that I'm not going to go into, but it is in one of our neck pain webinar that I've discussed a little bit more in detail. Exercises. You want to stretch, you want to strengthen, and you definitely want to challenge your neuroproprioceptive fibers and your hip. What does that mean? Your hip and the base of your skull are the two areas that provide maximum amount of information to your nervous system about your balance. So performing stretches and strengthening exercises are great for the soft tissue, muscles, ligaments, right? But there's these tentacles in your joints that send signals to the brain where it is. So if you're performing strengthening exercise, having a balanced exercise is very important. And one of them would be one of the balance exercises is to stand on a boso and just try to stand with your eyes closed. If you do that, you're stimulating the proprioceptive fibers at your joints, not just your hip, but also every level above that as well. So definitely have somebody spot check you on that at the beginning, and cross coordination exercises. So if you look at this B, which is passive, it's more like supine position. The person is laying down, so there's no weight bearing. And you could do these exercises, actually stimulates the proprioceptive fibers between your hip joints and your shoulder joints and stimulates the whole spine. Maintaining your posture is essential. I mean, you don't have to get a broom or a cloth or a path, but if you want, you're definitely more than welcome to. Any kind of resistive bands are going to be specifically for strengthening. And any kind of stretching is amazing for you, especially if you can incorporate even 10 minutes of yoga in your life. You made yourself younger, healthier, and happier. And trust me, people would rather be with happy person than an unhappy person. So warrior pose is very important. Pigeon pose is very effective for hip problems. And in yoga, they believe that you hold your anger in your hips. So don't let your hips be angry. It's a bad sign. The other subject is going to be sleep. What do you sleep on? Because your sleep posture is really going to affect the way that your body is expressing itself throughout the day, or what you do throughout the day is going to affect your sleep. So a lot of people think about pillow, and the pillow is going to be, but there's so many options out there. Like, what do you get? What type do you get? What consistently do you get? What's right for me? What's not right for me? Let me break it down into two parts. There are feel-good pillows, which is subjective, how it makes you feel. And then there are functional pillows, what they are supposed to do and if they're good for you or not. Feel-good pillows are different types of pillow. If it's a foam, if it's a down, if it's a hybrid, if it's latex, feather, those are your feel-good pillows. However, what really is important and what matters is if you do have postural issues like we saw, if you detected yourself or identified yourself with any of these images, or you tend to do a lot of that, then you want to be more cognizant of the type of pillow you choose, because when you're sleeping, let that body work for you rather than against you. The pillows that offer a curve, supportive curve for the neck, are the best pillows, because we spend how many hours? An average 18-year-old, based on Kaiser research study, an average 18-year-old spends about 7.5 hours on some kind of a smart device. So if you're 18 and above, you probably have a couple of years of spending a lot of time on your smart devices. So your cervical curve is extremely important to be protected. Pillow number 2, number 3, number 4, and 6, to me, are the most effective for people with neck problem. The pillow number 1, 5, and 7 are great to put in between your legs to kind of give you that support. If you do have hip issues, please make sure you're not laying on the side of your hip, but away, and then put a pillow on the upper part of your thigh. So don't put it in between your knees, put it between your thighs, okay? That's gonna help reduce the pain in your hip joint. You may also bring the upper leg, the top leg, over and let it rest on the pillow. If that makes you, give you a little flexion on your hip joint, it's going to help you. If you are suffering from headaches, neck pains, or poor posture, so I put together a toolbox with everything in there, okay? So everything that I typically have been recommending throughout the years, the past 25, 26 years to my patients, I put it into a kit, made it easy, because a lot of time I would tell a patient to get a resistive band and they're like, well, what kind? There's so many of them on Amazon. So these kits are put together and we were able to talk to the manufacturer and get a discounted price. So the combination of what you get on the kit is by far cheaper than what you can get on Amazon. And it's good for you. It's designed for your particular condition. So these kits are available for you online. You could just go in, order your kit, and start changing the body from above, because this part, your upper torso, is the one that's being affected most. And your posture exercises, the products are basically, this is how the items in the kits are. First, they help you reduce pain. Second, they help to prevent further damages. And third, most importantly, they give you strengthening exercises to keep your body protected and strong and reduce the rate of injury. So this is something that's typical in our neck kit. So you get a whole array of items. You get a posture support to bring your body back, especially people with neck problem, promoting the curve in the neck, and also some resistive bands and massage balls. The posture support that we recommend to change your posture, because your torso occupies a huge real estate in your body. So your torso occupies a bigger real estate than your pelvis and your hip. And once the torso is shifted forward and backward, it totally throws off the alignment of your hip, your pelvis, which affects your Q angle, also known as your hip and knee angle. So keeping your torso upright is very important, because your trapezius and your latissimus muscles are the two big muscles in the body that control the position of your head and your lower back. And they both are extensor muscles, okay? So the reason we chose this particular brace, and also known as the BAX-U brace, is because it retracts your shoulder, allows your body to be aligned in the sagittal plane, like the plumb line I told you, right? And then it balances out, because people have different rounded shoulder that we need to bring back into alignment. It stabilizes the area where the iliopsoas muscle starts. So that's an area that you want to make sure that is protected and has a reduced amount of loading. This product has also been tested with University of Michigan School of Industrial Engineering at corporate wellness events for people who are sitting at the desk for too long. We actually had 53 employees wear the device 4 hours a day, and in 12 weeks, 90% improvement of their posture. But the best part, 75% reduction of aches and pain, which translated, do you want to know what it translated to? Increased productivity by 21%. So that means you don't have to stop throughout the day and start rubbing your back, rubbing your shoulder, rubbing your neck, because those are not an issue you have to worry about. So there's no interruption in your activities of daily living. So you're a lot more efficient. Best part, it is covered on your flex spending account, health savings account. And it is in every kit that we offer. The rest of these products, you will find them on Amazon, Walmart, or eBay, other products. You're more than welcome to get them. Just know that when they compress your armpit, they pinch a group of with your finger, they can cause phantom carpal tunnel syndromes, which means that it's not a carpal tunnel, it's a misdiagnosis. It's due to pressure on the brachial nerves, also known as thoracic outlet syndrome. And so you don't want to make things worse, not knowingly, just because you saved $2. My name is Dr. Romina. Every Wednesday, we have a Wellness Wednesday. This is my way of giving back to the community. It's my way of reaching out to people that I may not see or that I might not be in your area. But if you do want to see me, you could either connect with me on telemedicine or come see me at my office in Los Angeles, California, on the corner of Robertson and Venice. So very close to 405 and 10 freeway. Thank you again for being with us, and thank you again for participating in this webinar. Have a wonderful day, and send us your messages, your emails, or if you know of someone that could benefit from this, please share the information. Have a wonderful day, and wishing you a great Wednesday.